Welcome back to the Nursing Ministry channel, a platform where we discuss nursing as a ministry and as a profession. We help you understand that there's a nurse in each and every one of us by default, and we help understand how we can use that nursing to serve ourselves, to serve our family, and to serve our community. For the new viewers, my name is Ludia Osita and I am a registered nurse. I created this platform to help you understand just what I've explained. And for the returning viewers, as usual, I thank you, and thank you again. Now, in case you're watching this video for the first time and you may not understand what this discussion is all about, I'd advise you to watch our previous videos where I'm explaining what nursing is all about, and we have built one video on top of the other, and it is an episode that precedes every episode is a build-up from the previous episode. So kindly watch the previous videos if you feel lost anywhere within this video, and it shall be well. Now, we have been discussing about nursing, and we've been looking at this person who has been interested in joining nursing as a profession, decided to apply to a nursing school, went through all the prerequisites, passed, was taken into the nursing school, and now they are sitting for their courses. So I'm helping understand what these courses look like. So just to give a snippet so that anyone interested in joining nursing school will understand what it is all about and make an informed decision. Now we spoke about the first course, that was anatomy and physiology. We went through the body systems. And then we also discussed in our previous episode, fundamentals of nursing, otherwise known as foundation of nursing. And we saw how, we saw the basic things that really make up the entire nursing curriculum, the things that one really makes a nurse. We looked back at the history of nursing and the cultural aspects of nursing, understood that there are different cultures that will meet at the healthcare setting, and there are various ways that there are specific ways that each culture has to be carried through. For instance, the Orthodox Jews have this kosher diet, and it entails not serving milk and meat on the same tray or on the same plate. They don't take it together. So that means whenever you're serving an Orthodox Jewish, you make sure that you do not combine milk and meat on their same meal tray. That is just one of the things. Kindly watch our previous episode to be able to understand better. Now, in today's video, we're going to look at a new topic altogether, a course that a nursing student should expect in their first semester, and that is the trends in nursing. The trends in nursing, and specifically ethics and etiquette. Now, because of the length of this topic, we're going to have part one today, and in our next episode, I'll introduce you to the second part. And so for today's episode, we're going to look at the ethics part of it. Trends in nursing, ethics specifically. Now, ethics really is the actions that drives one's decisions. Those actions within a person that makes them to decide on doing one thing or the other, and it really zooms in on their behavior. It zooms in on why they do what they do. Now, when you look at it in terms of nursing, we're trying to understand what are these behaviors that are acceptable in the nursing setting. In the healthcare setting. So this is not just for the nurses, it is also for the healthcare practitioners, anyone working in the health setting. What are these things that really is expected for the healthcare practitioners to be doing in terms of their behavior that will be considered acceptable, and when they deviate from it, it calls for attention, it calls for to be reprimanded, it calls for, disciplinary actions. Now, to help you understand better, be it the healthcare practitioners, whether the nurses, the doctors, the physical therapists and all, they are all coming from their various backgrounds. That is obvious. some from Africa, some from Asia, some from North America, South America, Canada, Australia. They may end up meeting in one healthcare setting, whether it is colleague per colleague or the healthcare workers and their patients. So they may end up receiving a patient who maybe was a tourist in their country, they fell ill and came into the healthcare setting or facility, and they have to take care of them. So let's say we have this person from Uzbekistan. They have shown up to your country for tourism in Africa. So they end up falling ill and they come to the facility. That patient has come in with their own culture, with their own norms, their own behaviors. They have their own ethics that they practice from where they come from. And you, on the other hand, the nurse, the physical therapist, the occupational therapist, doctor, you have your own. So if it was allowed that everyone should practice their own, have their own ethics, apply their own ethics in the work setting, it is going to be very confusing. There's going to be a clash. And so to avoid that, these ethics have been set out so that there's a standard. No matter where you're coming from, there's a standard way of behaving, there's a standard way of acting as a professional, as a healthcare professional. So I've just tried to break it down, and that is what ethics really is all about. Now, ethics is broad. It is not something that you do in private and then in public you act otherwise. It is something that you do both in private and in the public. So it is broad range. Unlike what we will discuss next week, etiquette, which I don't want to introduce today, it is more situational. It goes from situation to situation, and then you adjust as you go on. So for ethics, it is something inbuilt, something that you do whether you're in the private life or in the public life. For instance, when you talk about lying or stealing, you do not steal from family members in private or lie to them in private, and then when you go out into the workplace, you switch and now tell the truth. That is what I'm trying to explain, that ethics is something that you carry on from the private life to the public life, something inbuilt that you do over and over again, no matter the setting where you are at. So having understand that part of ethics, I'm going to discuss 6 main ethics of nursing. Now, the first one I will talk about is autonomy. Then we have what we call justice. Then we have non-maleficence. We have beneficence. We have veracity. And we have fidelity. So it may not be in order, but once again, we're going to discuss autonomy, justice, veracity, fidelity, beneficence, and non-maleficence. So this is what really makes up the ethics, and you'll understand what they all mean as we journey along. Now, nursing is a ministry, right? As I have been discussing every day. To help you understand that there were nurses in the Bible, and this is by default. Watch the first video and understand what I mean, if this is your first time. So now, in terms of autonomy means self-governing. It means independence, really. It means making your own decisions. Now, in nursing, when we talk about autonomy, we're trying to say it is that point whereby the patient has the right to make their own decisions in matters health and illness. They have the right to decide whatever they want to happen in their lives in matters health and illness. So, for instance, a patient who has come into the healthcare facility or sought medical attention gets to be explained to by the physician about their diagnosis, that they've done tests, and for instance, they found that they have cancer. Now, the doctor explains to the patient that to treat this cancer, they may need surgery, they may need radiation, they may need chemotherapy, so on and so forth. It is the doctor's duty to explain the diagnosis, the treatments, and everything concerning this disease that the patient has. However, It is the patient's sole right to decide whether to go for the treatment or to reject it and go home and live their best lives and pass on. The doctor has no obligation to coerce the patient to take the treatment. They've got no obligation to threaten the patient about what could be if they do not follow whatever prescription they're being given. That is what I mean by autonomy. Again, the patient has the right to decide that I don't want surgery, I want chemotherapy only. Or I don't want chemotherapy, I only want surgery. Now, this doctor can go ahead and tell the patient for where the stage where this cancer is, maybe stage 3 or 4, chemotherapy may not be sufficient. The way we do it, we have to do surgery first and then go on into chemotherapy. Or we need to do radiation before we go to chemo and, explaining to the patient what really is required. So it is for the patient to take all this information and then decide what they want for themselves. That is what I mean by autonomy. It is a matter of independence. The same thing applies even for the nurses, because now this is trends in nursing. You as a nursing student, you are being taught this course so that you will understand that whenever maybe you're going to give the patient medication, maybe they took it on the first day, they took it on the second day, the third day, second week, but they feel that this medication is making them so nauseous. They are so nauseated all the time, they are uncomfortable. And so the patient decides, I'm not taking this medication any longer. It is not for you to decide whether they should or should not take that medication, or push it on them, or force them to take it. They are independent, they are self-governing. They will decide whether to take it or not. However, you can go ahead and ask them why. There's a way to ask. We'll talk about this in communication. Is there a reason why you don't want to take it today? They may end up saying the reason is because I'm uncomfortable. It's making me nauseated. Then you can go ahead and tell them there is another medication that can be prescribed to help them not to feel nauseated, so that they can continue with their treatment and still have this medication and get better. If they go ahead and, because now they have an informed decision, they're being told something else, that actually there's a way that nausea can be handled, then the patient can agree and continue. You have not violated their right to autonomy, but you've given them more information. Now they can make a decision based on what you have told them. So I do hope you've understood autonomy. Yes, they have the right to their own health and illness. They'll decide, I don't want more treatment. I've lived my best life. After all, I am 90, almost 100 years old. What's surgery for? They have a right. Or they may say, I don't want this treatment, I want the other one. Is it possible? And if the doctor says, yes, actually we can go in that direction, and this is what this one entails, then the patient can go ahead and get, they are being given their right to autonomy. So, having understood that, let's look at the Bible to help you understand better. We have in the book of Deuteronomy chapter 28, God Almighty set out some curses and blessings, and he told the children of Israel, I have set for you curses, blessings, and curses, life and death. Choose life that you may live. And there was a long list of the things that if they do, they get the blessings. And another long list of the curses that if they disobey and not follow commands, those were the curses. Then God Almighty said, choose. But he told them, choose life that you may live, and left it to them. Being human beings, being men, looking at the book of Judges, the reason why it's even called Judges, the children of Israel would turn to other gods, worship other gods, follow the gods of the Amorites and the other people that they found there, the ites. They would worship them. God Almighty, because he understands autonomy, he understands independent self-governing, he leaves them to the gods that they have chosen. When things get thick, they can't handle it anymore. They cry out to God. They cry out because of the oppression. And because he is merciful, He hears their prayers. He hears their cry. Out of mercy and compassion, he responds to them. What does he do? Raises up a judge, because there were no kings at that time. He raised up a judge. He would raise up a judge to govern them, to help to lead them to war. And so they'd fight the enemies, defeat them, and have peace. 5, 10, 15, 20 years. With their short memories, again they'd go back to the same act. Sin against God, worship other gods. God Almighty again would worship other gods. And then when things got so hard, they would be oppressed by these people because of what they have chosen. Remember the curses that they were told about if they disobey and go the other way. So these curses would come upon them. Now it would be too much for them. They'd cry out to God. God would have mercy, raise up another judge, and then the judge would lead them to war. Once they win, they get peace. They're serving God for a while. Again, they would sin. So this was a vicious cycle. So we're seeing autonomy, God giving them the benefits and the cons of obeying and not obeying him and disobeying him. They go ahead, make their own choice because they have a right to autonomy. They face the consequences, cry out to God. God would raise a judge. And then that was a cycle that was ongoing. Just to help you understand that in the Bible, we have such a case. I could go on and on some of the instances of this autonomy and help you understand more. But let's move on to the next ethics. Now we're going to let's talk about fidelity, the second part of this ethics. Now, in fidelity, it is all about keeping promises. You've heard the term infidelity in a marriage, when one couple does not keep to their vows, when one spouse does not keep to their vows. So infidelity is a word, the main word from infidelity, or rather infidelity from fidelity. So it is a matter of keeping promises. Now, whenever we are talking about fidelity, keeping promises in the healthcare setting, remember we're talking about nurses, doctors, all the healthcare workers, because this is a standard that they should maintain, that all of them should maintain a fidelity in the workplace. For instance, for a nurse who goes on to see the patient and tells the patient, maybe the patient says, please, I've been here for a week. When I'm at home, I wash my hair every day. So this is a patient who every day they take a bath, they wash their hair. But because they've been sick, they've been in a critical condition, yes, they've been bathing in hospital, but their hair has not been washed, maybe with the shampoo that they use at home and all conditioners, and they just feel that now that they are feeling better, if they could have it done. Now, it is not an emergency. And of course, the nurse still has other things to do, giving medications, changing dressings. They have to make, there are some decisions that they have to make that, how do I put it? They have to plan their day and see what really is more important than the other. So of course, you cannot take care of the hair while there's a patient who hasn't received their medication. So the nurse may make a promise. Remember, we're talking about fidelity, keeping promises, and tell the patient, let me finish 1 to 3. I'll be back with you in about 2 hours, or before the shift ends, I'll ensure you have your hair cleaned today, and I will do it myself. So the patient knows that this nurse is returning before the shift ends, maybe at 3 p.m. in the evening, to take care of their hair. They are waiting for their hairdo. Now, fidelity means that this nurse has to return to the patient and do that hair because they made a promise. They have to come back and give them that hairdo, wash their hair as they promised. Now, peradventure, it has been a very busy shift, and before the shift ends, there was a new admission that this nurse had to handle, that the time has extended. They're seeing that the work is so much, maybe they'll have 1 more hour before the shift ends, and that is when they're getting a new admission. Clearly, this admission is more important than the hairdo that this patient is waiting for, because they have to settle the patient, do everything that the doctor has prescribed. They can't ignore this and go for the hair wash. But they made a promise. So in order to maintain fidelity, it is the nurse's responsibility to go back to their patient and tell them, I know I promised that I'm coming to do your hair before this shift ends, and I still intend to keep the promise. However, I have received an admission that I'm handling right now. So this hairdo may have to wait just a little bit, but I will return and do it as promised. They have still kept their promise. They have still kept the end of the bargain, because they have come to explain that they're not able to do it at that particular time at the end of the shift, which they promised. However, they are finishing with what they're doing, and then they will return back to fulfill their promise. That is fidelity in nursing. The patient may end up saying, do not worry, I can always have it done tomorrow. Will you be here tomorrow morning? Yes, I'll be here tomorrow. Or no, I will not be here, maybe for another 2 days. It is now the patient who will decide, oh, it's okay, I'll ask nurse so-and-so to do it for me. Thank you for letting me know that you cannot do it today. Or I'll wait for you to do it for me tomorrow. Hopefully, it won't be as busy as today. Communication. You've kept the end of the bargain. You've kept the promise as a nurse. That is fidelity. That is keeping promises, just as an example. Now, in the Bible, yet again, we see the story of David and Jonathan. These were very close-knit friends. They really loved each other. The Bible says Jonathan loved David as himself. That is how deep that love was. Now, there's a point in time when Saul was pursuing David, before David left the palace to run off. Jonathan knew that David would become king, and he knew that God would avenge him of all his enemies. But he made David promise that he would show him favor, and he would show his family favor. Meaning, even if Jonathan should die, David will show favor to Jonathan's bloodline, his family members. David made that commitment that he would do so. Years later, after Saul had passed on, Jonathan had died, David sat at one point and asked, is there somebody from the house of Saul, meaning Saul was the father of Jonathan, is there somebody from that house that I could show favor for Jonathan's sake? David could have said, Jonathan is dead. He's gone. The father was mean to me. He pursued me. He made my life difficult. What business again do I have with the family? Or he could have assumed everyone was dead. But because he had made a commitment, he had made a promise years before, he asked, is there somebody from the house of Saul that I could show favor for the sake of Jonathan? Because the commitment he made was between him and Jonathan. And so, by good luck, there was Mephibosheth, who was Jonathan's son, and he was crippled. That's a story for another day. But that's another example of fidelity now in the Bible. That we have a man who had made a promise. The person he made a promise to has passed on. He could have assumed the whole family had passed on. But he went and searched his heart, because I made this commitment. Could there be that there was somebody still in that family that I could show favor for the sake of this person that I had made commitment to? That is fidelity in the word of God. Ladies and gentlemen, now let's look at the third ethics, and we're going to look at veracity. We've talked about autonomy, I've explained. We've talked about fidelity, I've explained, and how the nurses are required to uphold fidelity at the workplace. And again, not just nurses, we have all the healthcare workers, and that is what you're supposed to uphold. So I'm just giving an example, one, the doctor, and another example with the nurse, and on and on. So let's look at veracity. Now, veracity is about telling the truth. Telling the truth. Truthfulness at the workplace. All healthcare workers are supposed to be truthful. Now, for instance, at the working place, having gone through night shift, we are all working in the night. We've maybe shown up for the shift. We've done all that needs to be done, given medications, treatments, and of course, the patients fall asleep. However, not all patients fall asleep. Others will keep you awake, maybe out of confusion. Others are anxious. They have surgery the following day, or they have a new treatment, maybe their first chemo, and so they're wondering how is it going to be, with everything they've heard about this kind of thing. So there are different things. Some will sleep soundly, others will stay awake for one reason or the other. Now, when they are awake, they have the call button. Call button is the button they press, and then the light comes out on their doorway to signal the nurse or anyone to go and help or assist for one thing or the other. Now, let's assume we have this patient who has been kept up, maybe out of confusion or even pain. They've been so uncomfortable. So that means it's going to be a long night for the nurse. You're in and out of the room because maybe you responded the first time, assessed the patient's pain level, went and got your pain medication that had been prescribed. You give it to them. After 30 minutes, the patient is still restless, saying the pain is not resolving. You check on what next is there. You give them another one, stronger. Then it still does not resolve the pain until you end up calling the doctor and saying, I've given everything you prescribed, but this pain is not being resolved. Is there anything else that we can give? And the doctor prescribes something much stronger that this time sedates the patient. Sedating means now they can fall asleep. However, this time they're falling asleep is maybe 5 or 6 a.m. Now, the nurse who's been on this shift gets a phone call from the family. And they ask, okay, so how has the patient been? How did they sleep? Are they well? Are they getting better? Veracity means that you tell the truth. Not to tell the patient, the family that, they slept so well. In fact, they are even still sleeping at 6 a.m. They are okay. They are comfortable. Don't worry about it. They're okay. That is not veracity. That is telling a lie. You as a nurse are supposed to clearly tell the family what happened. And that means they had a difficult night. Of course, there's a way to present it so that you don't cause chaos on the other side and throw them off. But you tell them that they had a difficult time. They have been in pain through the night. We've given them medication and they managed to sleep at 6 a.m. You've told them the truth. But you're not telling them how they were screaming, how they were grinding their teeth, how they were crying the whole night. There's no need. But tell the truth so that they will know that they were in pain the whole night. Something has been done about it. And as we speak, they are comfortably sleeping. So the family knows how the patient has been. The good thing about telling the truth, I believe in prayers. And prayers do work. So if you tell them they did not sleep well, what have you done? You've signaled them to keep on praying and even to know what the prayer point will be. Oh God, give them comfort. Help them to sleep. Relieve their pain. But if you tell a lie, they do not know how else to go about it. So that is veracity. Another part of veracity is when the patient, for instance, there's a patient who's been brought to the emergency room and you've received them. They were in a road traffic accident. Having received them, they're in a critical state. Then maybe an hour later, the family comes in frantic. They are worried. And they ask, how are they? Don't tell them they're okay when you know that resuscitation is ongoing. Of course, you don't want to increase the anxiety, but tell them the truth. They came in a critical state, but the doctors are working on them and resuscitation is ongoing. As simple as that. Then be with them. We are going to talk about the emergency room later. But tell the truth. Tell the truth. Another one, maybe the doctor has done a diagnostic test. They've done endoscopy. That is a scope, something like a screen that goes, a tube with a screen on a tube that goes through the mouth into the digestive system, just to see how the stomach looks like, the tube, esophagus, the intestines, to look inside. So you, as a physician who has been doing this diagnostic test, when you go in and you find, I'm seeing cancer in here, but you're looking at their family and how anxious they are. After the test, when you're sitting to give the report, do not tell the family all was well in there. We only saw a bit of ulcers here and there, but all is well. Simply because you're thinking you don't want to put them through stress. The doctor is expected to tell it as it is. We found this, we found that, we found the other. Now, very important to note, in veracity, we tell the truth even if it hurts. We tell the truth even if it hurts. Not that we enjoy the pain, not that we enjoy hurting, but it is the responsibility of the healthcare workers, the nurse, the doctors and all, to tell the truth. And then there is a way we manage how the patient responds to the truth given to them. But that is veracity. All right, ladies and gentlemen, we are going to look at the Bible also. And in this case, we look again at David, but this time not with Jonathan, but with a prophet called Nathan. David had sinned against God. He had taken somebody's wife, killed the man himself, made this wife he had taken pregnant, and she had born a son. God Almighty was angry at this, and he sent a prophet called Prophet Nathan. Go to David, just to alert him that what you've done is wrong, and I'm passing judgment on this matter, being the righteous judge that I am. Now, when Prophet Nathan got to David, he didn't go directly. He went through a parable. There was this man who had one ewe lamb, that is a female sheep. He loved it so much, it ate from his plate, it drank from his cup. Whenever he went to sleep, it slept on his arm. It was like a daughter to him. And there was this other man who was rich. He had a lot of sheep and cattle. And then he received a visitor. And instead of taking one of his animals and slaughtering for the visitor, he went for that one ewe lamb that this poor man had. And David got angry and said, it is such an evil thing. That person needs to be judged, Then Nathan told him, David, that rich man, that is you. It is you who has done that. The Lord says, I gave your enemies into your hands. I gave your master's wives to you. I gave you everything. Even if you would have wanted more, I would have given it to you. What business did you have taking another man's wife and killing him? And now you've impregnated her. And now David, good thing about him, he repented and God forgave him. But God told him, much as I've removed your sin, that child is going to die. Now David knew that he's dealing with a merciful God. So he wore sackcloth, went on the floor, did not eat, he went into fasting. He refused to get out of the ground and fasted for 7 days, hoping that God in his merciful act would respond to his fasting and prayer and show mercy so that the child would not die. Now the attendants were concerned. They would speak to him, try to get him, please come and eat. David refused to eat with them. He refused to get out of that ground. He was so distraught. Now, on the 7th day, after the 7th day, that child died. Now the attendants were concerned. They said, if we tell him the truth, if he's been like this when the child is ill, that he is not listening to us, he's not getting out of the floor, he's in mourning, he's in distress. This is how he has been. Now what will happen when we tell him that the child is dead? He's going to do something desperate. He might even kill himself. He will take desperate actions. So when David saw that they were speaking, he asked them, is the child dead? Guess what the attendants did? They did not sugarcoat it. They told him, yes, the child is dead. I'll stop my story there. There are two examples of veracity at work here. One, Prophet Nathan telling David as it is. In fact, he went around and started off with a parable to show him what I'm about to tell you. He didn't go straight, he just told him there was this man and explained it to him. Then told him, now, David, you are the one. I'm sure Prophet Nathan loved David. The Israelites loved David. He was a king who had helped them in many wars and led them in wars to deliver them from, the Philistines and all. So there was nothing against David by him telling him. But because Prophet Nathan had been commanded by God and sent with that word, he did not sugarcoat. He told David everything the Lord had said. The attendants practiced veracity also. They knew it would hurt David by knowing that his son has died, and especially in that state that he was in. But they did not twist their words. They told David, yes, the child is dead. Ladies and gentlemen, that is what veracity is in the healthcare setting. When you see a nurse telling you the truth of what is happening, of course, there are things that nurses should say. There are things left for the doctor to pronounce. We will talk about that. But when the patient is dead, they are dead. When the patient is in a critical condition, they are told they're in a critical condition. When a disease, the doctor has done all they can do, they will tell the patient the truth. I'm sorry, we have done all that we can do. The truth, so that we don't have cases whereby the doctor is extorting money and knowing very well that they have done all they can do. This person is just spending money on nothing, on something that will not work out. I'll stop there, but please, I do hope you've understood what veracity is all about. Let's move on to our fourth part of ethics. And now you're understanding why it's important for all the healthcare workers to practice these ethics in the workplace. It truly benefits you as a patient, but we're also going to see how it works amongst us. I'll talk about now colleagues when we get into the next. So let's talk about justice. Justice, being the fourth part of this ethics, is when fairness is expected. Fairness in terms of distribution of resources. It may be human resource, it may be physical resource, financial resource, but there has to be fairness. A rough idea. You have this country. Now we're talking about the health sector. They know very well that in the city, the population is high. And so, of course, they need more healthcare facilities, from clinics, maybe to level 1 hospital, level 2 hospital, until level 5 or 6 hospital. They have to have a trauma center because it is a big city with a large population. Fine. Then they also know that they have other states or counties, depending on what you call them in your country. And it is less densely populated or scarcely populated. It does not mean that they do not require clinics, they do not require hospitals, they do not require maybe trauma centers, because accidents happen all over. It can happen anywhere. However, fairness means where it is densely populated, they need to have more of these facilities, unlike where it is sparsely populated. That is fairness. If they ensure that, yes, in this county, at least we have a hospital, we have clinics, we have the trauma centers, and there's a way that they have distributed it so that these people are able to access it whenever there is need. And in the city, they have zoned out the entire city, and they have set up these facilities so that people can get they can get healthcare provision whenever it is needed. That is fairness. Now, injustice or unfairness is when that county has got no clinic, has got no hospital, and anytime somebody is sick, they have to travel to the next county to get help. They have to travel to the next state to get a trauma center. Now that is what we call injustice. there's no equal distribution of healthcare facilities. Now, if you are to look, for instance, at during vaccination drives, we have times maybe when we say we are having a polio drive to eradicate polio. We want 0 case of polio. So whether you were born and given this polio vaccine, the country, the health, ministry may decide that children from the age of 0 to 5 are going to get this polio vaccine because their goal is to eradicate polio, and we have 0 cases. So they have to target from 0 to 5 years old. Maybe that is when it will be effective. Now, the nurses have been given these vaccines all over the country, whether in the city, the urban areas, the towns, the villages, because it is the entire country they're trying to eradicate polio completely. So even in the most interior part of the country, there will be a nurse or a healthcare worker going around a zone that has been marked for them to ensure that every child from 0 to 5 or 0 to 10, 1 to 10, gets vaccinated. And after vaccinating them, they put a mark so that in case anyone else comes to monitor or check out whether they've received, they will find that mark and know that this child has been reached and has been vaccinated. So when we have this drive, you as a nurse who is in the community, and you've been given the vaccine, you're in that part of the country where it's so hot. You have to trek through maybe a semi-arid area. No one is watching you. But veracity plays out when justice plays out when you know that I have to be fair. Just as I have given that child that I've left behind near the town of this semi-arid area, I have to walk and get to that hut where there are 5 children and this widow or this family that is across the dry river there and give them this vaccination. That is justice. That is fairness. You have done for this child or these children in the village what you did for this child that you started off with in the town. Equal distribution of resources. You have gone here, you have gone there, you have done the same thing for each and every one of them. So you have not shown favoritism and took care of these children and gave them the vaccination, but neglected the other one because you thought that one is too far. Who is going to trek under the hot sun? You know, I don't even have a bicycle to go there. But it is not so far. That is why you are given that zone. Only that you are reasoning out that it is too hot, it is uncomfortable, no one is watching me, how will they even know, you know? That should not happen. And so that is just another example of veracity, being fair, doing the same thing for all. Now, in the healthcare facility, for instance, we have cases whereby we have different people in the healthcare facility. Let's say during admission, you have a patient who is pleasant, they are kind, they are cooperating with the treatment, you know, whatever has been prescribed, they're just pleasant. Let's put it that way. Then we have another patient, maybe they are rude, they are angry, maybe they've received a diagnosis that is making them angry. They are bitter. They have all these emotions oozing out. Now, justice, ladies and gentlemen, means that you will treat this pleasant patient the same way you will treat this difficult patient. When it is time for the medication, if it is 8 a.m., as much as you've given medication for this pleasant patient at 8 a.m., you will not look at that room and say, oh my goodness, who is going into that room? Who is going to handle another abuse, another hateful remark? You'll go into that room and give them their medication at 8 a.m., just as you did the other one. When this pleasant patient presses their call button, calling for your help, you will respond just as fast to this pleasant patient as you would the difficult patient. That is justice, ladies and gentlemen. That is justice in the healthcare facility. There is no discrimination. Everything has to be equal. Now, do we have a case in the Bible in matters justice? Yes. Yes, we do. Now, in the Word of God, we have the case of, actually, it is injustice, but it will help you understand what justice is all about. We have the case of Elkanah, who had married two wives, Peninnah and Anna. When it came to the distribution of meat, much as he loved Anna, he would give Peninnah and her children a portion each. But when he got to Anna, he gave her a double portion because he loved her. That is injustice. Injustice. Coming to Jacob, at the time he had 12 sons. Yes, Benjamin had been born at that time. He had 12 sons. He went ahead and made a coat for Joseph only. He could have made a coat for each of his sons, even if it meant revamping up and making sure Joseph's was a bit brighter. But he didn't make a coat for any of his other children except for Joseph. That is injustice. It is not allowed in the healthcare facility. That is an example, ladies and gentlemen. Jesse, when he had many sons, I believe about 8, including David, when Prophet Samuel showed up to anoint David as king, the Lord had not shown him that it was David. So when he went to the household of Jesse, he asked him to bring his sons, to gather them. He gathered all his sons for Samuel to identify who was king. But where was David? In the field. Why didn't he call David? Why did he think David could not be king? Samuel said, bring all your sons. He didn't say bring the ones that looked like they could be king. So Jesse practiced injustice, Elkanah practiced injustice, and Jacob practiced injustice. Something that should never be done in the healthcare facility. So now I do hope you understand justice, ladies and gentlemen. Let's move on. We have 2 more. And that is, the first one is beneficence. Beneficence means, it just comes from the word benefit, to benefit, to do something good for the sake of somebody else. So, when the healthcare provider, the nurse, the physical therapist, anywhere in the healthcare setting, we are supposed to do good to benefit the patient, for instance. Now, an example of this. The patient has this wound that is removing exudate, that is pus. However, it has been bandaged. So the exudate, when it gets into the bandage, it dries up. And so that bandage will stick on the wound bed. Now, for instance, the doctor has ordered that this dressing should be changed once daily, meaning every day, every morning, that bandage should be removed, the wound cleaned, and then another clean bandage applied. Now, if this is a prescription, and the nurse now shows up at the bedside, looks at the wound, does all the assessment, and they're ready to do this dressing, they could remove that bandage, but remember, it has stuck on the wound bed. So what happens when they're removing the dressing? They are peeling off. It is so painful as they remove. The patient may probably be screaming, crying, grinding their teeth, clenching their teeth. You know, they can see, even before they handle the dressing, the patient is in pain already. It is a wound. It's removing pus. If you've had a wound, there are times when that extremity is even heavy and painful to move because there's no blood supply. The oxygen is not flowing well. Whenever there's no oxygen in any part of the body, pain is imminent. There has to be pain. No oxygen, there is pain. So the fact that there's a wound, that means the blood vessels there are not bringing oxygen and the nutrients. So there'll be pain with the wound. And so the patient is in pain even before the nurse touches the wound. So beneficence means the nurse can do certain things for the good of this patient so that at least they are in a comfortable state. They can choose to simply unwrap the dressing, tell the patient, be strong, don't worry, I'm almost done, I'm almost done. And as they continue, the patient is in pain. But beneficence means they can, for instance, give them pain medication 30 minutes before touching them, before changing the dressing. Of course, they will not prescribe the pain medication. We have what we call PRN medication, prorenata, meaning as needed, whenever the patient needs it, every 4 hours, every 2 hours. So they can go ahead to their medical administration record and find out, what medication can I give this patient? What pain medication has been prescribed that I can give them at this point in time? They'll go ahead and give the patient the pain medication, wait for 30 minutes or an hour. When the patient feels comfortable, they can take a normal saline or sterile water and pour on the dressing before touching the dressing to remove it. If they pour on the dressing on the above the wound and allow that dressing to soak a little bit, the dressing will be loose enough so that by the time they are removing it from the wound, it is coming out smoothly and not pulling on the wound bed. Now, this will promote healing because if at all there was any fresh cells that are growing in the wound bed, they are not pulling it off. But by removing it smoothly, they are only removing the parts that they need to anyway clean out. Then remove it, and during the cleaning, this one who is not practicing beneficence will go ahead and clean, wipe the exudate maybe once deeply, and this is causing pain. But the one who is doing good for the benefit of the patients, the one who is practicing beneficence, this nurse will probably go layer by layer, wipe slowly and remove the pus. Take another clean cotton wool or gauze and wipe again and remove. They are doing something good for the sake of the patient. They are practicing beneficence. I hope you've understood, ladies and gentlemen, that it is doing something good for the benefit of the patient, because they have a choice to say who has time to give them medicine, wait for an hour, pour the normal saline, wait for it to soak a little bit, then start. But because they're practicing beneficence, a code of ethics that is required to be practiced in the healthcare facility, they will put all these things in mind and decide to do this for the sake of the patient's benefit. There's a lot of beneficence in the Bible. Jesus Christ was the King of beneficence. He was the Lord of beneficence. But let's look at Ruth and Naomi. Go to the book of Ruth. There is a beautiful story about two ladies. Of course, it involves others. We have Elkanah, the husband to Naomi. We have Mahlon and Chilion, the children to this couple. But I just want us to look at Naomi and Ruth. Naomi was the widow, and she had a daughter-in-law, Ruth. Now, their other family members have all died, and they have to go back to their country. Now, Naomi, being old, is telling the daughters-in-law who are Moabites, stay here. This is your country. Let me return to my own country. One of the daughter-in-laws, Orpah, decided, okay, she kissed her mother-in-law goodbye and went. But Ruth, being the beneficent, maybe she was even a nurse. Of course, she was a nurse at heart. By default, looked at her frail mother-in-law and thought, is she going to walk back all alone, back home, to her city, to her country? And when she gets there, How will she be taking care of herself? Everyone is gone. Who will be cleaning for her? Who will be cooking for her? Who will be fending for her? She's going to suffer. Maybe that is what went on in her heart. So Ruth decided, come what may, I am going with you and I will take care of you. Your people will be my people. Where you will die and be buried, I'll be buried. Your God will be my God. The fact that she says your God will be my God meant she's bringing herself under the God of Naomi, who is the Almighty God. She's gone under that covenant of being a child of Abraham because she said your God will be my God. Anyway, to cut the story short, Naomi agreed and they went together. Now Naomi had not mentioned to Ruth, but you know what? By the way, I have a man who is more or less, he's a kinsman redeemer also. His name is Boaz. And when I left with my husband and my sons to come to Moab, that man was not married. Let's go back and find out if he's not married. Then I could introduce you to him because he's a kinsman redeemer. You will have a husband and then you will continue this lineage of our son, whether Mahlon or Chilion. She did not mention to Ruth that there was somebody there who was Boaz. She didn't tell Ruth about Boaz. But Ruth practiced beneficence and decided she was going to go with this old woman, her life notwithstanding, whether she ever marries again or not, she was going with Naomi to take care of her and at least make her life comfortable. And as it were, when she got there, again, she despised herself, I would say, and decided to go and glean in the farms. The people who gleaned at the time were poor people. Gleaning meant when the harvesters are harvesting, they don't take everything. The law at that time was that they should not take everything from the farm, that they should leave at least something small, so that when poor people would come, they would find something from the farms that would help them or sustain them. So Ruth did not think of herself, who is going to do that work, let us just wait around. She went to the field and gleaned with the rest. She didn't even seek for employment as such. She went and started gleaning. And it is in the process of gleaning that Boaz noticed her. So what am I saying? Ruth was being beneficent. She was practicing beneficence by doing something good for the benefit of Naomi. It wasn't so much so about herself, but to benefit Naomi, to care for Naomi. She could have gone around Moab and gotten married again. She could have gone maybe with Naomi and sought for another man. But Boaz even commented and said, you have not, when Ruth now went to the threshing floor in the night, Boaz made a statement and told her, you have not gone after the young men. Meaning Ruth was not thinking about who is going to marry me. But she went really thinking about Naomi. And in the process, God rewarded her and she ended up getting Boaz. That is beneficence, ladies and gentlemen. Let's look at non-maleficence. And that is our last code of ethics. Now, in non-maleficence, just think of the opposite of beneficence. And that is doing harm to somebody else. Now, in nursing, we are not supposed to practice maleficence. Maleficence, mal means bad. So maleficence is bad against benefit. You see the word efficiency, bad efficiency. Now, we are supposed to be non-maleficent. So non-maleficence should be practiced in nursing. I'm talking to you, the student in nursing school. You who is learning about nursing, these are the things you'll be taught. So non-maleficence means avoiding doing harm. The other one was intentionally doing good for the benefit of others. But now non-maleficence means you are avoiding doing harm. I will give an example again. The doctor comes and he's drunk. And he's asking for the file to go to room 44 to see patient XYZ. Clearly, this doctor came next to you, asking for the file. His breath is reeking of alcohol. His eyes are bloodshot. but he has come to work and he wants to go and see this patient. What will you do as a nurse? You who is being taught about non-maleficence. Will you watch him walk and go to the room and do nothing about it? Now, you are expected to report that immediately to the supervisor or the nurse manager. Why am I saying this? So that you do not take it in your hands and tell the doctor in his face, you are drunk, you cannot go into the room, you cannot see this patient, I cannot let you. No, it is disrespectful, it is wrong, it may come out in a very wrong way. However, you are not supposed to seal your lips and let him do it and say, I will report it tomorrow. What if he's gone to perform a procedure at the bedside to draw bone marrow? The worst could happen to the patients. So in order to prevent harm from happening to the patient, he may end up going to prescribe things and yet he's drunk. Instead of writing 56 milligrams, he ends up writing 56 grams. He ends up doing things or even approaching the patient in the wrong way, giving the wrong diagnosis to the patient, and you've left him to go. So immediately you're supposed to report to the supervisor or even the nurse manager so that it can be handled immediately. Now, he may end up talking to the patient, doing what he's doing, but by the time he returns, the nurse manager is there waiting and they have a way of handling it. Please refer to the episode where I talked about the nursing hierarchy and what the role of each nurse is all about. Of course, there are other things that you can do for the safety of the patients and practicing non-maleficence. And that means maybe the supervisor is not around, the nurse manager is not around, but you have contacted them. Don't let him go to the room by himself. Accompany him. You're practicing non-maleficence because you're protecting that patient from harm. You're protecting them from hurt. So when you are around and you're listening to what the doctor is saying and how he's acting, by the time he wants to do something, at least you are around to protect the wrong thing from being done. Of course, push comes to shove. There are some decisions that may have to be taken in a respectful way, and this will prevent harm befalling the patient. Ladies and gentlemen, I think we are going to end here in our episode today. We've talked about ethics in nursing, trends in nursing, and looked at ethics. In our next episode, we are going to look at the etiquette in nursing. But I do hope you've understood. And you're seeing the importance of all these codes of ethics being practiced in nursing. The autonomy, the independence of the patient to make their own decision, informed decision in matters health and illness. We've looked at beneficence, how you're going to go out of your way to do good for the benefit of the patient and its importance. We've talked about non-maleficence, avoiding doing harm to the patient, avoiding doing harm to your colleagues, avoiding doing harm in the healthcare setting or even causing hurt to the patient. We've looked at justice, how we're going to practice fairness, whether the patient is difficult or pleasant, they all deserve equal care when they are in your hands. We've talked about veracity, and this means telling the truth. Even if it hurts, you tell the truth and then you handle the situation, having told the truth at all times. And then finally, we've looked at fidelity, and this means keeping promises, keeping to your commitment. So I will leave you at that. Thank you so much for sticking through, for staying with me and understanding all this. Wait a minute. Let's talk about how we can apply this in the family. Because nursing is a ministry, right? You are at home. In 1 minute, I'll help you understand this. When you're at home, that patient that is sick has the right to their health and illness. Are they not a patient? They're a patient at home as much as they are in the hospital. So they have a right to say, I don't want that medication. And when they say, I don't want it, it is their right. Do not get angry. You can call the doctor and say they've been taking this medication well for 2 weeks. but they say they're not taking it for 1, 2, 3 reasons. The doctor may say, put them on the phone. Let me talk to them. Maybe explain what are the consequences of not taking. Should they refuse to take this medication? Because they have a right. Even God himself, we've seen, he allows us to practice autonomy. Then the patient has the right to say no. We can encourage them, but if they say no, do not treat them otherwise. Do not get angry. Do not refuse to care for them simply because they have practiced autonomy and said no. Continue with the care. Continue giving them the rest that they will cooperate with, that they agree with. So this should help families to understand. Don't get angry. Don't turn your backs on your family members when they refuse treatment. Don't be resentful. Don't say, well, you refuse to take the pain medication. Now you are in pain. You're on your own. They have a right to choose what they want or don't want. Now, since they've refused to take that pain medication, but they are moaning and groaning in pain, what is your role in the home? How will you handle the situation? There are other ways to handle pain. Repositioning, massage. There's putting it, whatever part of the body in warm water or cool baths or hot, There are ways to do this to ease the pain because they've refused the medication. So that is how you apply autonomy in the home setting. Surely, having described and explained how the Bible has demonstrated all these areas, we know now how to apply it in our own settings. When we have a sick person around, how to be truthful to them, how to be just. When one family member is sick, maybe the last born is sick. They've been sick maybe for a week, vomiting, diarrhea, having fever. Of course, because we are all nurses, we've been caring for them. Then, peradventure, that on their 4th day of sickness, the firstborn also falls sick. But they're not having diarrhea, they're not vomiting, they are sick, maybe they're feeling dizzy, they're having joint pain, maybe malaria has kicked in. Don't say because he's the firstborn, he should be strong enough and do 1, 2, 3 things for himself. The lastborn is sick, or vice versa. The firstborn is more sick, the lastborn, it is just this and that, it's just fever. No. Practice justice. Practice fairness. The same way you would handle the firstborn when he's sick is the same way you should handle the lastborn when they're sick. The same way you're dealing with fever is the same way you'll be dealing with cancer. So everyone is sick. There's no sickness greater than the other. There's no pain greater than the other. Give attention to each family members equally so that there won't be a case arising that when this one is sick, they get this kind of care. However, when I am sick or when so-and-so is sick, they are left to themselves. They should go to the kitchen and get their food, or they should come and get their food and eat. This one is being blended for, pureed for when they can't swallow. This one is being told just slice it and eat it. No. Nursing as a ministry requires that we practice autonomy, veracity, fidelity, beneficence, non-maleficence, and justice in the home, in the community, for ourselves at all times. That is why it is ethics. We do it whether in the hospital or whether in the family in private or in public. To avoid stretching this episode longer, I do hope you have picked out something and how you can apply it. I do hope you who is going into nursing school, you have a better understanding of what trends and nursing is all about. I wish you the best, and I hope that you pass and get your license and come and join us to become RNs. And once again, my name is Ludia Osita. I'll see you in our next episode. Have a beautiful day. Goodbye.